that's too bad. I mean, that's too difficult to pass the US. It would really cause harm. Okay, so we didn't really force it or anything. We tried gently, and and then when I had resistance, I switched to the regular gastroscope, and I saw this, and we stopped. So, does she complain of trouble swallowing?
Oh, definitely.
All the time, right?
Always has.
Okay. Yeah, so that's the cause.
Ever since time began.
Yeah, that's the cause, because that's very difficult to swallow through. So she should stick with soft things, and if we need to, we can gently dilate it. But that dilation is a process. I mean, we cannot just dilate and put the US. That would rip it. But gently, you go in multiple sessions until you get to a point where you can pass the US. But that would take several weeks, because you dilate and then wait until it heals, and then you dilate. And if you dilate very aggressively, even if you didn't rupture it, if you cause the major bleeding here, it's very close to the airway.
Yeah.
So people, if they bleed in close to the airway, they can really asphyxiate even.
Right.
So this is not where you would pass a US scope for. I'll let the doctors involved know, because the other option is to see. It's probably very, very difficult for interventional radiology to biopsy this, but if they can, attempt and see if they can biopsy it under CAT scan guidance.
Oh, okay. So
Difficult for what?
For interventional radiology.
Intervention.
Interventional radiology, what they can do is, under CAT scan guidance through the skin, try to find a safe pass to pass it to the lesion and see if they can get it. The reason it's difficult is because it's very small. 1 centimeter. It's located in the head of the pancreas, which is difficult too.
Yeah.
But I think if we're gonna biopsy it, this is the next step.
Okay.
Yeah, I'll let Dr. Zhu know, and then he will decide if that's appropriate.
Right. Right.
Yeah, but for me, because even radial scope is difficult to pass. The linear scope, where we pass the needle, is even harder, because it's even larger. Yeah, so we don't want to cause harm here.
So you did no testing at all?
I didn't.
So we know nothing now that we knew before?
Yeah, that's correct. Yeah, it's really very tough to pass the US through, and I don't think this can allow US to pass through without causing harm.
She has always been low on iron. She's always been taking those
iron pills.
Prenatal
iron
pills,
thing.
Right.
She takes them religiously.
Yeah.
Right.
Yeah, so there's a syndrome called Plummer-Vinson, where iron deficiency can cause a web right in the upper esophagus. And it looks like a shelf. You can see the web here. It's like almost like a shelf. So that putting stiff object through would rip it.
Yes.
Yeah, so I'm sorry, I didn't do anything, literally.
Right. Well,
Yeah, we tried.
Also, she has a hard time swallowing pills?
yeah.
Yeah, it would be a good idea to crush her pills.
She does.
And drink
She
it.
does. Yeah.
Plenty of water.
But there was a couple here that she couldn't.
We grind her pills to a powder.
Yeah, that's a good idea.
They had to cut it.
Yeah.
Yeah, so I'll let her doctors know.
Okay.
Thank you.
You're welcome. She's
we
gonna
have-
wait. Yeah, go ahead.
We have no way of knowing whether it's malignant now or not, do we?
Oh, this thing here? No, we
No,
didn't.
I mean the
Pancreas.
the pancreas.
The pancreas is not bleeding, but we don't know the nature of the pancreatic lesion.
That's what I mean.
Yeah.
Yeah.
So we don't know until we get tissue.
That's right. We can't get any.
And we cannot get tissue through the ultrasound. This is actually the easiest way to get tissue, because when we pass, if we could pass the ultrasound, then the duodenum is right here, and the lesion is right here. So the pass is the safest, because you go, and within like 2 centimeters, you're there. Okay, so that's to say you don't have to go through a lot of tissue to get there.
Right.
But when that's not possible,
Yeah.
because we don't have endoscopic ultrasound scopes that are tinier, I mean, it needs a lot of development to make these things tinier. Then the next step is to try to go through the skin. And of course, they would numb the area and give a little bit of sedation and see if that's feasible. But the person who would decide that's feasible is a radiologist, interventional radiologist, because it's really actually very tiny, 1.3 centimeter. For me, if I can pass the ultrasound here, it's easy, but for them, there's plenty of tissue here, so it might be more difficult.
Right. Right.
Yeah, so we will consult interventional radiology
Right.
to look at it.
So the other way, Dad, to see it is to come through her outside into the skin.
Mhm.
So there's another way, but it's
Mhm.
more challenging.
It's more
So,
challenging.
Yeah.
Correct.
Okay.
And now, are we concerned about the throat itself now? Is this something
Yeah.
else we might be treating? And
Yeah. So this can be stretched gradually. Okay. Either we have to stick with soft things, crush tablets, and have soft diet. But if we decide to stretch it, has to be multiple sessions.
Right.
So every couple of weeks we stretch, let it heal, stretch, let it heal. And with that, there's a small risk of rupture or perforation, but if we do it gently and carefully, we can stretch it gently. But for immediate purpose to pass the EUS, we need really to stretch, because the diameter of this scope is about this diameter is less than 7 millimeter. To allow 12 millimeter, this is a big jump.
Oh,
yeah.
huge.
So you cannot do it in one
yeah.
session without bleeding or perforation.
Oh, yeah, no.
Yeah, but if you go by 2 millimeter every session, 2 to 3 millimeter, 2-3 sessions, we might be able to get to a point where she can swallow better. Especially in a location right here, because it's close to the airway.
Okay.
If bleeding happens, it will be aspirated.
Right. Right.
Yeah, but if we are looking to help with that, we can gently stretch it on multiple sessions. But I think I would deal first with
Yeah. Before we try to. Okay.
How bad is the problem there now?
the pancreas lesion.
Yeah.
The pancreas lesion
how
is
bad is that problem that's existing?
so the pancreatic lesion is only 1.3 centimeter.
So it's not a big thing.
It's not big, but if God forbid it was spread, that signifies a big problem. Because if it reached the pancreas, that means it spread to the bloodstream. That it reached the pancreas, no matter how small it is. So even if it was 5 millimeter, but it was truly the colon cancer spread to the pancreas, then it's stage 4. That means it got to the bloodstream, and they can go to other organs soon.
Right. Right.
Yeah, now it showed up in the pancreas. 2 months later, it will show up in the lungs and other organs.
Right.
So that's why they would, they would like to know what stage, because treatment would be different.
Yeah.
And prognosis would be different.
So we can't treat it for stage 1 if it's not stage 1.
Right.
Well, I think they can do surgery even if it's stage 4, if the tumor is obstructive or if it's bleeding. But without that, without obstruction or bleeding, if it's stage 4, then you don't want to go for surgery unless it's stage 1. If it's stage 4 and you do surgery and no obstruction and no bleeding, then you expose her to surgery and then found out later you didn't cure it. You went through the surgery and then found out later you didn't cure it. So I think there's ways to go around. One of the ways to try see if interventional radiology can get it. If they couldn't get it, or they said it's really too difficult to get, there's a study called PET scan. PET scan is not tissue, but cancer is more likely to light up with the PET scan. So if the PET scan is negative and there's no way to sample it, then I think we have no choice but probably to assume and be optimistic and assume it's stage 1 and then wait in a matter of waiting and seeing.
And see what happens.
Exactly. And that they take it and follow her, and if 3 months passed and there is no metastasis, meaning that this probably was benign thing.
Yeah.
The other thing, if she had old CAT scans, that would be helpful. So let's say she had a CT a year ago, and that was still there. That tells you this is not cancer. Okay,
Right.
because there are other benign pancreatic lesions.
Yes.
But if that lesion was present way before, has she ever had CAT scan before for any reason?
Seems maybe for her knee at all?
Well,
No?
Yeah, CAT
for
scan
her
is
knee?
really where they would put her inside the tube, looking at the
Oh,
abdomen.
yeah,
It has to be
she
abdominal.
had them. She had them, yeah.
I think
Yeah.
so.
She had
Maybe
abdominal
that's-
CAT scan.
I
Oh,
don't know.
I would say so, yeah.
Yeah,
She's
usually
had
they
all
do.
kinds of operations, I mean.
Yeah, they do
Yeah.
CAT scan.
When they did her knee, would they do that when they operated on her knee?
Yeah, the knee, they would do MRI of the knee. That doesn't involve the
They
abdomen.
wouldn't do
Okay.
all that.
They would do abdominal CT in case somebody is having pain. So somebody, let's say, had severe pain a year ago, and then
Well,
they
let's
saw
ask the
their...
doctor, see if we had.
I think you're right, Dad.
I'll,
'Cause
I'll,
she's
I'll ask him.
Yeah, who's the primary doctor?
Shabazz.
Shabazz, okay. So what we can do is
We can contact him.
We can see if Dr. Shabazz has records of all CT.
Sure.
Right.
If the CT showed that lesion, let's say present 2 years ago,
Yeah.
then that's great news. But if this is new, we didn't see it, then we cannot really tell. Especially if she had.
We should have done that before, shouldn't we?
Well, you know, see, I'm here to provide a service. I'm like not GI consultant.
I understand.
Yeah, so the GI consultant is Dr. Spanner, and then the oncologist asked me, because I'm the only one who does endoscopic ultrasound. So I didn't even do a consult. It just said, can you do endoscopic ultrasound for us? And then even I was like under the pressure because I'm off last weekend. And then Friday they said, well, we have colon cancer, let's wait. So I didn't see her on Friday per the request. Then Saturday, Sunday, I got 3 texts. Hey, can you do the US on Monday? Can you do the US on Monday? I mean, the oncologist and the surgeon and Dr. Boya, I got 3 texts. So I know I have office day between 7:30 and until 5. So I called and I told them, please put her right after the office. Okay? And finished the office, ran right away, talked to you. Yeah. So here, like I didn't do a consult. I'm just providing service because they already did the consult. They're already general GI.
Yeah, and this was the best.
Yes.
It really was
so
the best.
I had no time to look and dig because I'm not the GI consultant. You know, it's like you're asking interventional radiologists to sample. They sample. You know, they don't do full consult and things like that. Because there's a GI doctor who's seen her before.
What is a PET scan? I don't know
Yeah,
what that
PET
means.
scan is a study that has a substance that they give when they do the CAT scan. And if you have metabolic active cells, these metabolic active cells would take that substance and it would light up. So, and usually the most active cells are cancer cells. So most of the time when it lights up, most of the time that means cancer. But also if you have focal infection in some area, which is unlikely, why would you have focal infection or inflammation in the pancreas? Is very unusual. So if the PET scan lights up in this area, then this is suspicious. You know, then at that time they might treat it at stage 4. But you know, I'm talking here on behalf of the oncologist, and I shouldn't.
We appreciate it.
Thank you for the
Yeah, I'm just
guidance.
telling you what I know. So I think the best thing, I would let the oncologist know. I would let Dr. Spanner and Dr. Boya know. And then maybe they can dig and see if there's old CAT scans that were done earlier and compare if this is old or new. And if we don't have old CTs or this is new, we have old CT and this is still new, then at that time our option is either interventional radiology or PET CT. But I'll leave that up to doctors.
Thank you.
Yeah, I'm so sorry, okay?
Thank
You're
you.
welcome.
Thank you. This was amazing information.
Thank you so much.
Thank you.
So let me open the thing in here.
Thank you.